This video is sponsored by Bootcamp.com. Check it out for INBDE prep and use coupon code MENTALDENTAL for 10% off. Hey everyone, Dr. Ryan here, and welcome back to our ethics series. In this video, we'll cover the ethical principle of justice. Justice is the fourth principle of ethics that we'll discuss, and it's also referred to as fairness. Under this principle, the dentist's primary obligation is to be fair in their dealings with patients, colleagues, and society. And this includes delivering dental care without prejudice and improving access to care for all people. So first, we have patient selection. Dentists cannot refuse to accept patients into their practice or deny dental service to patients because of their race, their creed, that's their religious beliefs, their color, gender, sexual orientation, gender identity, or national origin. So we need to be free from prejudice about the type of person that someone is. And in accordance with the first advisory opinion of justice, you also cannot refuse a patient only because they have a developmental disability or a communicable medical condition like HIV, hepatitis B, or hepatitis C. However, you as the dentist can exercise reasonable discretion when selecting which patients to treat. So if you don't have, let's say, the knowledge, the equipment, or the expertise to treat someone with a certain disease or disability, then you can reasonably refer them to a specialist under the principle of non-maleficence, not doing harm to them. Here's another example. If someone is just outright abusive to a staff member or blatantly disrespectful, that is grounds for dismissing them or not treating them altogether, which goes back to patient dismissal, which we discussed in the last video on beneficence. So hopefully you're starting to see how this idea of patient selection from justice is connected to but different from patient dismissal from beneficence and patient referral from non-maleficence. Emergency service. So this one is really important and comes up on the board exam a lot. So we have an ethical obligation under justice to make reasonable arrangements for the emergency care of patients, whether or not they are our patients of record. So if the dentist is on vacation for the weekend and there's no phone number or email address to reach them, and the office is completely shut down with no staff coverage, that would be a violation of justice. It would not be fair to patients who are in need of our help. And then, if emergency care is rendered, we would tell the patient to return to their regular dentist for continued care. In other words, we wouldn't then try to steal that patient for ourselves after providing some emergency treatment, unless the patient specifically requests to be seen by us for future treatment. Justifiable criticism. So we are obligated to report continual faulty treatment to the appropriate reviewing agency. An open margin on a restoration, a gutta percha that's a little short, these are things that happen and that's okay, but repeated offenses or gross issues need to be reported. At the same time, we must not make disparaging comments about other dentists in front of our patients. So we should not say, wow, your dentist really botched that extraction. Instead, we would say something like, I noticed a retained root tip that should be removed to reduce your risk for future infection. So we should inform patients of their present oral health status without making disparaging comments about prior dental services. The advisory opinion here expands on the word justifiable and says that we really need to be sure that this is an example of mistreatment before reporting it. Otherwise, we could get in trouble for just blindly reporting something before getting the full story. So if it's possible, reach out to the dentist that did the treatment and get the full story. What were the circumstances under which the treatment was rendered? Maybe the patient can't open wide and visualization was really difficult, and that's why part of the tooth was left behind, or something to that effect. Expert testimony. So dentists may provide expert testimony when the testimony is essential to a fair trial. Basically, what this means is dentists of different specialties can be called upon for their expert testimony in dental or related injury cases. And these injuries can be due to an auto accident, a fall, professional negligence, or injury by an animal. And the practitioner is asked to evaluate the injury, to write up a report, and maybe testify in a deposition or a court of law for a professional opinion as what's called an expert witness. So that's a civil duty that we as dentists have, and it falls under the principle of justice. And then for obvious reasons, it would be unethical to agree to getting a fee under the table contingent on you ruling one way or the other in that court hearing. You can't be paid in favor of a certain side. All right, and the last one, rebates and split fees. So dentists shall not offer or accept rebates or split fees. So the question is, what do these terms mean? A rebate means to return part of the original payment back to the patient. And then split fees, if you set up a deal with a referring dentist and tell them, I'll pay you 20% of the profits I make from each patient you refer me for services, that's unethical. The advisory opinion says this also applies to third-party advertising companies. So let's say you pay a local magazine to help advertise for you, and you tell them, hey, I'll pay you 10% of my profits this month in return for getting the best front cover ad you can make for me. That's another example of a violation of justice. All right, so summary of justice. You have to select your patients fairly. You cannot discriminate based on the characteristics of a person. You must be available for emergencies. You cannot slander other dentists' work, but at the same time, you do have to report mistreatment when you have the full story. You have to report as an expert witness when asked, and you cannot accept or provide rebates or fee splitting. That's it for this video. Thank you so much for watching. Please like this video if you enjoyed it, and subscribe to this channel for much more on dentistry. If you'd like to support me, please check out my Patreon page. And thank you to all of my patrons for their support. You can unlock access to my video slides to take notes on and practice questions for the board exams, so go check that out, the link is in the description. Thanks again for watching, everyone. I'll see you in the next video.